So we will talk about the epidemiological concept. So the topics that we will cover during this session, which is the introduction to epidemiology. The first objective, a public health approach to epidemiology. What is epidemiology? And the key concept and terms. Also calculating rates of epidemiology. We talked some of them before. Approach and methodology. Data source and study design in epidemiology. Investigation in case of outbreak. So those are the objectives that we will cover during this session. So it is a public health approach for epidemiology. So in the surveillance of organization, this is the preferable reporting unit here in Oman. So the reporting unit, it is either from primary healthcare center institution, hospital and secondary and tertiary, laboratory and private and other sectors. So all of those sectors, they are reporting any cases that it need to be studied in case of epidemiology. So in case of infectious disease or reported cases, it has to be reported either from any of those institutions. So it will be reported to the Governorate Directorate of Communicable Disease Surveillance and Control at DG office at that Governorate. There is a technical advisory group for that. So non-Ministry of Health Governorate Health Organization also all of them, they are reporting to Department of Communicable Disease Office of DG of Disease Surveillance and Control in Ministry of Health quarter. So after reporting to the DG office, then it will be reported to Ministry of Health. Also, those cases, it has to be reported to International Surveillance, WHO, at the region, at the Middle East region. So any case of infectious disease that it has to be reported, there is a special format for that. When any patient came to any institution in the healthcare, this institution will fill that format and it has to be reported. Some of the cases it has to be reported immediately. Some of the cases it is according to the case and the dangers of that disease. So some of the diseases it is reported weekly or every month sometimes. It depends upon the situation. In order to prevent the outbreak of the disease, the public health approach, the surveillance of what is the problem, they will investigate what is the problem and what's the cause of it, which is the risk factor identification, then intervention and evaluation, what they have to work. There is a portfolio and there is a worksheet that they have to follow. And then implementation, how do you do in this case? So there is a problem and the response. And also the main thing that it has to be reported. Also, in the main thing of the epidemiological disease and epidemiological study is, in order to do that public health, the main function of it is to prevent prevention, which is mainly the most effective thing. So when we identify the case earlier, we can prevent others from getting the disease. So in public health, there is epidemiology, there is the epidemiological or the preventive measures. There is the laboratory that we have to confirm that the cases is there. There is the informatics also. Informatics, they are helping because of the use of computer and the internet and the communication. By that, we can communicate with others in order to notify them about the cases, which is in case of any outbreak of any disease. So by that, they will take their precaution and they will take the preventive measure in order to prevent the spread of the disease. And then the surveillance around the world. What is epidemiology? The meaning of epidemiology, we took it before. So epidemiology, which is mean upon, or the demos, which is mean people, and ology, which is mean science. So epidemiology, it is the science which deal with health and the health of the people. So it deal with the health of the people, and bring between biomedical and social and behavioral science. So it would deal with them in all aspects. Also, the study of distribution on and determinant of health-related status among specified population. So it is the study of distribution of and determination of health-related status among the specified population and the application of that study to control health problems. So the main point and the main aim of the study is in order to prevent the spread of the communicable disease. Who is the epidemiologist? The epidemiologist is a professional who strive to study and control the factor that influence the occurrence of the disease. So those persons who are qualified to study the factor and control the influence of the occurrence of the disease or health-related condition and event in a specified population and society. Has experience in population thinking and epidemiological methods, and is knowledgeable about the public health. So they have to be knowledgeable about the public health and how to deal with it, and causal interference in the health. So this is the last green dictionary of epidemiology. This is the last definition of it. Epidemiologists are required to have some knowledge of what are the knowledge that the epidemiologist has to know. The public health, because they emphasize on the disease prevention, so they have to be as knowledgeable in public health. Clinical medicine, because also they emphasize on the disease classification, diagnosis. So they have to understand, especially here, the communicable disease, and the pathophysiology. The pathophysiology, which is the changes which happen in case of that disease, because of the need to understand the basic biological and mechanics of the disease, which is the nature history of the disease in the body when it affects the body. So they have to be knowledgeable in public health, clinical medicine, in order to be able to diagnose and to understand the type of diseases that might immigrate there, and the pathophysiology of the disease, the changes. Then also they have to know the biostatistic. The biostatistic, because of the need of the qualified to quantify the disease frequency and its relationship to anticipate or the demonstrator testing and hypothesis. So in order to see how much that disease is spread, and also to calculate the rate of it, and in order to see that is it locally in a certain area, or is it and you remember when the start of the COVID-19, when it started in China, it was started in one town, then it was spread along to all over China, so it became epidemic. Then it was transferred to other countries until it became pandemic. So this is the study of the disease, and the aim of it is to prevent it from the spreading from that area, from the local area to the whole town or to the whole country, then to other. Social scientists also, because of the need to understand the social context in which disease occurs and presents, social determinants of health and phenomena. Why they need to understand the social phenomena within the population? What are the social phenomena here in our country that might help in the spread of COVID-19 if we take that disease? What are the social phenomena that? Yes. So in case of Eid, in case of wedding, parties, and what other thing? Our social habit also, shaking hand, hugging people. Those are all of those habits. It will increase the spread of that disease because it is spread by the respiratory disease, and it is spread by droplets. So when direct contact is there, when in this case, it will increase the possibility of spread of that disease. So if we understand the way of the spread of the disease, by that we can also find a way to prevent its spread. Like if we took other disease like E. coli. E. coli, it can spread by what we call it orophycal route. So if they are not cleaning their hand after coming out from the toilet, it can be transmitted there. It can be transmitted from the sewage to the wells. So it depends upon the spread. It depends upon what's there in the community, what's the habit also in that community, and how we can deal with it. Purpose of epidemiology, the purpose of it is to investigate and understand the nature and extent of the health-related phenomena in the community and identify then the priority of that phenomenon. The study of natural history and prognosis of health-related problems also, and to identify the causes and risk factors within that community, and recommend and assist in application of evaluation, the best intervention in either preventive and therapeutic measures. So the intervention, there are divided to two types, which is the preventive measures and the therapeutic measures. So in order to investigate which is the most appropriate preventive and which is the most appropriate also therapeutic measures for that disease. Also to provide the foundation of public policies in order to formulate a policy. And you see that there is the superb committee which is there in order to have a public policies that all the people should follow during that breakdown of outbreak of that disease or that phenomenon. Epidemiological purpose for public health practice discover the agent, the host, and the environmental factors that affect the health. So for each disease, there is agent, which is the causative agent, and host that harbor the infective microorganism, and the environmental factor that help in the spread of the infection or prevent the spread of infection, and that affect the health. Determine the relevant importance of causes of illness, disability, and death. Also identify those segments of population that have the greater risk of the specific causes of the illness. Because of that, they are taking precaution for certain people than others, or they are taking precaution for all, but those people, they have to take more precaution than others, like old age, like small children. Evaluate the effectiveness of health programs and the surveillance, the services in the improving the population health. Solving health problems. In solving health problems, the first thing we have to collect data about the problem in order to understand the health problem. So it is the surveillance and determine time, place, and person who are affecting. And then the step 2, which is the assessment, which is interference, which is interfering with that. Step 3, which is hypothesis, formulating a hypothesis related to that phenomena, and determine how and why it is spread, how it is spread and why it's spread. Step 4, action, which is the intervention that to be taken in order to treat and prevent further spread of the disease. So all of the following illustrate the purpose of epidemiology in public health except one. So which one is not illustrating the purpose of epidemiology in public health? Identifying the population who are at risk of certain disease. Is it true or not? Huh? Is it from the purpose? You are not here? True. Okay, yes. Assessing the effectiveness of the intervention. Providing treatment for patient in a clinical setting. Determining the importance of causes of illness. Yes. Providing treatment for a patient in the clinical setting. Providing the treatment, it is there, but providing the treatment, it is not by the epidemiologist, it is by those who are in the clinical area. So the lecture is too long, so we skip some of those. Epidemiologists also use a model of studying infection, worse disease, and spread that involve the microbial that cause the disease, the organism that harbor the disease, and the external factor that cause all of the diseases transmission. This is also known as host, vector, and transmission, host and environment, host, agent, and environment, organism, transmission, and environment. Which one is it? Mm-hmm. Yes, see. So, the key term for epidemiology or outbreak, it is disease occur among a population that is an excess of what is expected in a given time and place. Like hepatitis A. You remember a few years ago, I think 3 years ago, when there were an outbreak of hepatitis A in Bidia. So, cluster a group of cases in a specific time, so, and a place might be more than expected. So there are a group of people. It is not only one case. So group of cases at the same time in a same place. So in this case, it need to be studied in order to find the epidemiological factors. In endemic, it is disease or condition presented among a population at a time that, like measles, diabetes mellitus, diabetes mellitus, and hypertension, it is from non-communicable disease. Now it is all over the world. So measles might be outbreak of that. Pandemic, a disease or a condition that spread across region, like in case of H1N1. So it is pandemic all over. The rate, it is number of cases occurring during a specific period, always dependent on the size of the population during that period. So it is related to the size of the population. And every day you know that they are doing some, you hear in the news that they are doing a specific number of tests, and also they are announcing the number of tests in relation, the rate of the test in relation to population, and also the rate of positive tests in relation to tests that is done. So it is like this. So we skip that because we discussed it many times. Also, we'll skip it. The calculation rate, comparing population characteristic. So rate will help us to compare health problems among different populations that include two or more groups who are differed by a selected characteristic. So the rate, it measures the frequency with which the event occur in a defined population over a specific period of time. So the rate, it is the event or the number of cases divided by the population. So in a period of time. So number or event occur during a specific time period, like in case of hepatitis A, in the population, if we are taking the population of the year, so we take the population of the year, so number of cases over the number of population, it will give us the rate for that. So if we are having 100 cases and the number of population 100,000, it will be 100 over 100,000. So the rate in this case, it will be 1 to 1,000. Determinator or population at risk of developing the event. K is the constant, which is either the constant, it is the rate as either we will take it as a percentage, so it will be for each 100, or it will be for each 1,000, or it will be of 10,000. So it is according to the number of population. When the number of population is huge, is huge and the cases are few, in this case we will relate it to 10,000. When it is a small number of cases, usually they are taking it as a percentage. So it depends on period of time. It might be also per day, it might be per week, it might be per month, it might be per year. This is what we will take it in the statistics, the annual statistic. You will find those numbers. So place and time is place, time, and the population at risk must be clearly defined also. Epidemiological indicators, we had the morbidity and mortality. Morbidity, what do we mean by morbidity? What is morbidity? Yes. So those who are getting disease. The mortality, it is the study of death. Prevalence and incidence, also we have to study the prevalence and incidence of that. The prevalence is the proportion of persons who have particular disease in a population at risk of a specific disease at a point of time. So prevalence, it is number of cases with the disease who are getting the disease over the population at risk. So this is the prevalence. Population at risk, they are defining them according to many categories. Let's go again. The computer restarted. What's the time now? مظبوط الساعة. مش عارف شو جاب باله والله، نعمل ريستارت. خذوا لكم بريك 10 دقائق على بين ما يرجع يشتغل.